Today we will be talking about an important anatomical region of the upper limb, the cubital fossa, with its clinical importance. The cubital fossa is basically a triangular depression lying on the front of the elbow joint, right? This is the elbow region, and this triangular depression in front of the elbow joint, it is known as the cubital fossa. It has got three boundaries like the three sides of a triangle. It has got a base which is formed by a line known as the epicondylar line. It is not a true line, but an imaginary line which is passing between the two epicondyles of the humerus, the medial epicondyle and the lateral epicondyle. Then the other two boundaries, the lateral boundary formed by the brachioradialis muscle, while the medial boundary is formed by another muscle known as the pronator teres muscle. So a base, lateral, and medial boundaries. Base formed by epicondylar line, lateral boundary by the brachioradialis muscle, and medial boundary by the pronator teres muscle. The roof of the fossa is formed by three structures, starting from superficial to deep. The first structure, which is the superficial most structure, is the skin. Like anywhere else in the body, the superficial most structure of this cubital fossa, that is the skin, right? Next, if we remove the skin, we have the fascia, the superficial and the deep fascia, right? The superficial fascia has got some contents: the lymphatic vessels, supratrochlear lymph node, and the superficial veins. This layer, you can see this is the superficial fascia, right? The superficial fascia has got three contents, one of which is shown in this diagram, the superficial veins, right? These superficial veins, they are one of the contents of the superficial fascia, right? Then next to superficial fascia, this layer which is lying over the muscles, covering the muscles, this is the deep fascia. The next to deep fascia is the bicipital aponeurosis. In this diagram, you can see this is the skin, this is the cut part of the skin. The skin is cut. Below the skin is the fatty layer, the superficial fascia with its contents, which are the superficial veins, superficial nerves, and superficial lymphatics, right? Then when the superficial fascia and then the deep fascia are removed, next we will be looking at the bicipital aponeurosis. This is the bulk of the biceps muscle. This is the tendon of the biceps muscle, while this is the bicipital aponeurosis. So the roof of the cubital fossa is formed by three structures: skin, which is the superficial most, then the superficial and deep fascia, and then we have the bicipital aponeurosis. The floor is muscular and formed by two muscles, supinator muscle on the lateral side and the brachialis muscle on the medial side. This is the brachialis muscle forming the medial side of the floor of the cubital fossa, while this is the superficial, this is the supinator muscle forming the lateral side of the floor of the cubital fossa. In this diagram, this one on your right side of the screen, this is the bulk of the biceps muscle, while this is the tendon of the biceps and the aponeurosis. These structures are removed in the diagram on the left side so that you can see the brachialis muscle, right? This is the muscle which is forming the medial side of the floor of the cubital fossa. Next are the contents of the cubital fossa, and they can be memorized by the mnemonic MBBR, right? This is just a slight modification. Uh, MBBS, right? MBBS would have been much more easier, but you can if you replace the S with R, then MBBR. This can be helping you in memorizing the contents of the cubital fossa. From medial to lateral, if we go, the first content there will be the median nerve in the cubital fossa, right? Then next to median nerve is the bifurcation of the brachial artery. The next to bifurcation of the artery is the tendon of the biceps, right? The biceps tendon. And then the lateral most structure is the radial nerve. The radial nerve with its deep branch. In this diagram, you can see this is the medial side, while this is the lateral side. The medialmost content is the median nerve. Then next to the median nerve, we have the bifurcation of the brachial artery. Then lateral to the bifurcation of the radial artery is the tendon of the biceps. And then next to the tendon of the biceps is the deep branch of the radial nerve. The cubital fossa is an important region clinically, as like other flexor surfaces of the large joints that may be either groin, the popliteal fossa, or the armpit, and essentially the anterior part of the neck. It is an area where the blood vessels, nerves, they pass relatively superficial with an increased amount of the lymph node. So the cubital fossa, like other flexor surfaces, it has got superficial vessels, superficial nerves, and superficial lymphatics. During blood pressure measurement, the bell of the stethoscope is placed over the brachial artery in the cubital fossa, right? And the brachial artery, as already discussed, it is running medial to the tendon of the biceps. Statistics show that the antecubital fossa is the least tender region for peripheral intravascular access, although it provides a greater risk for venous thrombosis. There is a slight risk of venous thrombosis here, but this region, the cubital fossa, it is preferred area for obtaining intravenous access for taking blood samples from the veins and injecting intravenous medication, right? Because it is the area where the patient feels least pain. So it is that's why it is preferred. This is the end of the slideshow. If you have any query, you can ask me in the comment section below. Thank you very much.